Hello, hi everyone. Am I audible and visible, guys? Good afternoon. Okay, so welcome back, guys. I've brought some most expected PSM MCQs as well as PSM topics that we will be studying today in this rapid revision session. We'll be targeting it for 2 hours at least, okay, 1.5, 2 hours. And in case some of the questions are left, some of the MCQs are left, we will try to finish it today itself. All right. So, guys, just bring a cup of tea or coffee, sit along with me, keep looking at the questions, and keep revising PSM, everybody. Okay. Before that, I just want to announce that Unacademy has started a learning festival, guys. Okay, so in which you're getting the Unacademy subscription at just 299 everybody. You're getting the Unacademy subscription at only 1 second. Just a moment, guys. One second, everyone. This has got stuck or what? Stuck right now. Hello, can you all hear me now, everybody? Can you all hear me now, guys? Okay, so let us resume. Sorry for the issue, guys. A small bit of this thing. Yeah, so what I was saying that Unacademy is giving out the plus subscription at rupees 299, guys. 1 month plus subscription आपको 299 में मिलेगा, which is an amazing opportunity. The price is valid till 16th. Okay, so you can definitely think about taking the plus subscription and learn from your wonderful educators. You'll get an access to live and recorded classes and all the other things that the Plus platform has to offer you guys. Okay, so this is the Unacademy Learning Festival. All you need to do is use my code PSM10 or PSM Live and get a 10% and not a 10% but an Unacademy subscription at rupees 299. This is just to make your NEET PG and FMG preparation easy. So what are you waiting for? Do use this code and make use of the Unacademy Learning Festival. All right, so let us begin. Now, whatever questions I have said today are some of the topics that we should revise before we go to whether any of our exams, whether it's NEET PG or FMG. Okay, so the first question is, which statements best justify a cross-sectional study design? So we'll be going in an order, guys. Okay, we'll be studying some questions from EPIC, screening, and we'll try to look at the entire PSM through this. Okay, so can you tell me true and false for this one? Is the voice okay now? Aishwarya, is the voice okay now? Should I continue, everybody? Yes. So what is a cross-sectional study design, guys? Cross-sectional study क्या होता है? Okay, so what is a cross-sectional study design? You could get any of the study designs in your exams, guys. So look at the first option, temporal association between exposure and outcome. Does a cross-sectional study justify a temporal association between exposure and outcome? So I've started getting different answers. 5, 3, okay. Now let us revise about a cross-sectional study, okay? So the first thing that you have to know about cross-sectional study, everybody, is that it is, okay, the first thing that you have to know about cross-sectional study, guys, is it is a type of which study design? It is a type of observational analytical study, okay, analytical study. Then second point, what does it determine, everybody? It determines एक्सपोजर एंड आउटकम. हम एक्सपोजर एंड आउटकम दोनों को कब देखते हैं? एट वन पॉइंट ऑफ टाइम. ठीक है, एक पॉइंट ऑफ टाइम पे वी लुक एट एक्सपोजर एंड आउटकम. So since you're determining exposure and outcome at one point of time, it cannot establish what? It cannot establish temporality. Okay, what is the meaning of temporality? वो भी एग्जाम में आता है guys. टेम्पोरलिटी का मतलब क्या होता है? टेम्पोरलिटी का मतलब होता है cause precedes effect. Okay, meaning if you smoke, then only you can go on to develop lung cancer. But since you are determining smoking and a lung cancer at the same time, you cannot establish temporality. Okay, so look at the first statement, temporal association between exposure and outcome. This is absolutely false. This is the biggest disadvantage of of a cross-sectional study design. It cannot establish temporality. So, but what is good about it? That it can calculate prevalence of a disease. So if you are asked which study design can calculate prevalence of a disease, so कौन सा study design prevalence calculate कर सकता है guys? A cross-sectional study design. So next one, odds ratio. This is also wrong. Odds ratio कौन से study design में हम निकालते हैं, everybody? Odds ratio is taken out for a case control study design. So that is also wrong. Incidence of a disease, guys. Incidence is determined by which study? Incidence is determined by a cohort. Very good. Jill, Nishtha, everybody. Incidence is determined by a cohort. Burden of disease in a population. Now, prevalence is obviously telling me about the burden of disease, right? Prevalence is telling me about the burden of disease. No antecedent causation, that's absolutely correct. It cannot establish antecedent causation. Okay, so what is your answer? It can demonstrate burden of the disease. It can demonstrate antecedent causation. I mean, it cannot demonstrate antecedent causation. Antecedent causation matlab temporal association. So it cannot demonstrate that temporal association. Is it all right, everybody? Did you understand? So what does your answer become over here? Which statements best justify, guys? कौन सा best justify करता है statements? D and E. So the answer is fifth one. Thumbs up, everyone. We can expect a cross-sectional study design in the exams. सबसे पहले type. It cannot establish temporality, but what is the good thing about it? That it can calculate prevalence of a disease. All right? Okay. Proceeding to the next one. Chalo. Let's see if you can answer this. In context of epidemiology, following are important criteria for making causal inferences except. So what is your answer over here? Strength of association, specificity of association. Which one is not a causal association? Can you tell me? Okay, 1 second. All right, very good. So sensitivity is not a Hill's criteria. ये कौन सा topic है, guys? Here we are studying what is known as Hill's criteria. अब Hill's criteria क्या करता है, everybody? What does Hill's criteria do? Hill's criteria is important to establish, number one, to establish causality. Now, how can you learn about the Hill's criteria? You're absolutely correct. Sensitivity is not a part of Hill's criteria. ठीक है, अब Hill's criteria कैसे पढ़ोगे? So how can you study Hill's criteria? Okay, so let us talk about Hill's criteria. When you study Hill's criteria, everybody, the first thing that you're going to ask yourself, which is the most important Hill's criteria? क्या है सबसे important Hill's criteria? Anybody knows in the class? What is the most important Hill's criteria? So the most important Hill's criteria is temporality. What is the meaning of temporality, guys? Cause precedes effect. Okay, cause precedes effect. That means if you smoke, then only you will go on to develop lung cancer. And which is the study design which best establishes temporality? वो भी पूछ सकते हैं. So cohort study best establishes temporality. सबसे अच्छे से temporality को cohort study establish करती है. Next one, which is the least important or most difficult Hill's criteria, guys? सबसे least important या most difficult to establish क्या है? The least important या most difficult to establish specificity. Specificity means smoking will only lead to lung cancer? Not possible, right? It can lead to CVD and a lot of other things. Okay. Third point. Now go in an alphabetical order. Third important Hill's criteria is biological plausibility. Whatever we say, guys, should have a biological support to it. When I say smoking causes lung cancer, smoking obviously causes inflammation of the lung parenchymal tissue. ठीक है? तो एक biological background है, so biological plausibility. फिर चलेंगे हम 3Cs. Number one, consistency. Consistency means findings are replicable. Number fifth, coherence of association. Coherence of findings. Sorry, coherence of findings मतलब researchers support each other's findings. ठीक है, researchers क्या support करते हैं? Researchers support each other's findings. Okay, support each other's finding. Next, what is it that you will calculate? What is the next? It starts with the C. Cessation of exposure. If you stop smoking, the lung cancer will decrease. Last but not the least, dose रिस्पॉन्स रिलेशनशिप. ऑब्वियस है, अगर हम स्मोकिंग का डोज इंक्रीज कर देंगे, लंग कैंसर का चांस बढ़ जाएगा. एंड लास्ट पॉइंट इज स्ट्रेंथ ऑफ एसोसिएशन. नाउ स्ट्रेंथ ऑफ एसोसिएशन केस कंट्रोल स्टडी में किससे दिखता है? ऑड्स रेशियो. एंड कोहॉर्ट में किससे दिखता है? रिलेटिव रिस्क. Okay, how will you remember it? Just ask which is the most important health criteria. We all know it is temporality, and cohort study is the best one to establish it. Which is the least important or most difficult to establish? Specificity. Then go in an alphabetical order: biological plausibility, consistency, coherence of findings, cessation of exposure, dose response relationship, and strength of association. Clear? Thumbs up, everybody. So, what is the answer over here? Sensitivity. Sensitivity is not a part of Hill's criteria. Chalo, moving to the next one. Let's see if you can try to solve this. I just want all of you to revise the formulas before you go to your exam, whether it's NEET PG or it is FMG exam. You have to calculate over here relative risk of breast cancer in the patients exposed to the drug. So can you calculate the relative risk over here, everybody? ओके सबसे इंपॉर्टेंट क्या है रिलेटिव रिस्क क्या होता है व्हाट इज रिलेटिव रिस्क गाइस आई बी कंडक्टिंग एंड पीएसएम ओके नाउ इज जस्ट अ सेकंड आई यूज ओके कैन यू नाउ हियर मी एवरीवन शुड आई कंटिन्यू एवरीबडी ठीक है आप सबको सुनाई दे रहा है all right should we continue so here it is written I'll make the table for you breast cancer yes breast cancer I'm writing it here breast cancer it's written placebo 40 no breast cancer में placebo 960 this is 1000 guys new drug is 10 और यहाँ पे it is 990 and 1000. Now all I want you to do is everybody tell me the formula for relative risk. What is the formula for relative risk? We all know formula for relative risk is incidence exposed divided by incidence non-exposed. Yes, incidence exposed by incidence non-exposed. So can you tell me what is the incidence among exposed over here? If this is A, this is B, this is C, this is D. Now मैंने आपको total already लिख के दे दिया है. So here please remember exposed is one those who are using the new drug. Alright. So new drug कितने use कर रहे हैं? 1000. Out of them breast cancer is occurring in how many people? 10. So incidence exposed becomes 10. Very good Priya RP. And what is the incidence among non-exposed? Please remember प्लेसिबो इज नॉन एक्सपोज ठीक है प्लेसिबो तुम्हारा नॉन एक्सपोज हो जाता है सो कितने लोग नॉन एक्सपोज है अगेन इट इज 1000 एंड हाउ मेनी आर डेवलपिंग ब्रेस्ट कैंसर ओवर हियर 40 सो ऑल यू हैव टू डू इज इंसिडेंस एक्सपोज्ड divided by incidence non-exposed so that will become 10 by 1000 by 40 by 1000 so you can easily calculate this without a pen and a paper also how much will be your answer everybody Yes. What is your answer to this question? Point? Okay. So some of you have written answer. So what will it be? 0.25. Very good. So all I wanted to do is revise the formulas for relative risk and attributable risk. Let me tell you the formula for attributable risk also. Guys, यहाँ पे एक चीज याद रखना प्लेसिबो होता है तुम्हारा नॉन एक्सपोज्ड ठीक है और न्यू ड्रग होता है तुम्हारा एक्सपोज्ड सो what is the formula for relative risk remember it is incidence exposed among incidence non exposed and the relative risk of values could be more than 1 could be equal to 1 could be less than 1 so when it is more than 1 guys iska matlab kya hota hai positive association no association and negative association so here what has the answer come it has come as 0.25 so what is this is it a risk factor or is it a protective factor so over here this becomes a प्रोटेक्टिव फैक्टर 0.25 आया ना, तो इनवर्स एसोसिएशन हो जाएगा प्रोटेक्टिव फैक्टर. क्लियर एवरीबॉडी? फॉर्मूला फॉर एट्रीब्यूटेबल रिस्क इज इंसिडेंस एक्सपोज्ड minus incidence non-exposed divided by incidence exposed multiplied by 100. Like 75% of lung cancer cases is attributed to smoking. And population attributable risk क्या होता है? Incidence among total population minus incidence among non-exposed divided by incidence among total population multiplied by 100. Okay, so that is what is population attributable risk. Population attributable risk is of immense use to the policy makers. Done revision everybody. Okay, so please don't forget these formulas. And also there is one more formula for odds ratio. वो क्या होता है? AD upon BC. Okay, odds ratio का formula क्या है? AD upon BC. Odds ratio is calculated in a case control study design. Okay, let's see if you can mark this, guys. Okay, so what is your answer to this question, everybody? An investigator suspects that acetaminophen used during the first trimester of pregnancy can cause NTD. She estimates the risk of neural tube defect in the general population to be 1:1000. So which of the following is the best study designed to investigate the hypothesis? So what is your answer? Some are writing case control, some are writing ecological way. Now look, neural tube defects, and what is the frequency of neural tube defects? The risk 1:1000. 1:1000 मतलब for every 1000 children एक बच्चा ऐसा है जिसको न्यूरल ट्यूब डिफेक्ट होगा. ठीक है? So when you talk about neural tube defect, guys, it is a rare disorder, right? So when you have something which is a rare disorder, what is the best way you can do? You divide your population cases. So what are cases? Cases are children with NTD, okay, and आप इसको और किस में divide कर दो? Control. So control क्या हो जाएगा? Children without NTD, ठीक है? With NTD and without NTD. उसके बाद हम क्या करेंगे? What are we going to do? We can go back and ask about the exposure status. Exposure status मतलब acetaminophen लिया नहीं लिया, okay? So it is acetaminophen used, not used. Similarly, acetaminophen was used or not used. So what is the thing that you have to remember? Whenever it is a rare disorder, guys, a rare disease, okay? Rare disease होता है तो हम लोग कौन सी study use करते हैं? A case control study design. Simple. Any doubt in this question? Whenever you have a rare outcome, okay? जब भी आपके पास एक rare outcome है, आप क्या करोगे? You will use a case control. So here I want to make a golden slide for you, everybody. Please remember. Okay, let me first show you this one. Can you do this? Firdaus, did you understand here? Everyone understood? Okay, जब भी कोई rare disease है, rather than doing a cohort study, the best thing is to start with that disease. Right? So we will do a case control study design. Okay. What is the answer over here? To identify the type of study designs you can easily get in the exams. 500 women aged 40 to 54 who present for routine checkups are asked about their meat consumption. 20% of the women turn out to be vegetarian. During the ensuing 5 years, 5 vegetarians and 43 non-vegetarians develop colorectal cancer. Now, which type of study design is there? Is this? Tell me again, Ashish. Which type of study design is this? You have a group of 500 women. So, you have a cohort of 500 women. Okay. Anytime, guys, जब भी ऐसा question आएगा ना, try to find out what is your exposure and what is your outcome. So यहाँ पे तुम्हारा exposure क्या है, guys? What is your exposure history? It is vegetarian versus non-vegetarian, right? That is your exposure history. All right, an outcome that you are looking for is colorectal, and I divided it into non-vegetarians. Then what do? during the ensuing 5 years. What does this mean? Ensuing 5 years मतलब ensuing 5 years मतलब होता है next 5 years. So during the coming 5 years, we determine how many among vegetarians and non-vegetarians develop colorectal cancer. So यहाँ पे हो गया cancer, no cancer. Is it clear? यहाँ पे भी हो गया cancer and no cancer. So what are we doing? We are moving forward in time. So this becomes a cohort study design. Okay, just try to figure out whether you're talking, what is your exposure, what is your outcome. Are you starting your study at the present time and moving forward? So it will become cohort. You start your study at the present time and move backwards to determine, you start your study with diseased, non-diseased, it will become case control. ठीक है, so remember this is a very very important study. RCT में क्या होता है, you actually have a group of patients and एक को आप ड्रग देते हो और एक को आप नो ड्रग देते हो and then you follow them up. Okay, so let me make a golden slide for all of you. You're going to fill in the blanks, guys. If I have to study multiple outcomes, मैं कौन सी study use करूंगी? मल्टीपल आउटकम्स में कौन सी स्टडी डिजाइन आएगी? मल्टीपल एक्सपोजर में कौन सी स्टडी डिजाइन आएगी? Rare disease, which study design I'm going to use? Okay, fourth point, newer disease, which study design I'm going to use? And fifth point, rare investigation, everybody. Please don't forget this, rare investigation, which one I'm going to use. So for multiple outcomes, you have a cohort, exposed, non-exposed, follow them up for the outcome. So you can use a cohort study. Multiple exposure, start with cases control, move backward, determine the exposure status. So ये हो गया तुम्हारा case control. Rare diseases में start with diseased and non-diseased. So ये भी हो गया case control. Newer diseases, for newer diseases you have a nested case control, guys. Okay, nested case control. And for rare investigation also, everybody, we use a nested case control. So you could definitely get to identify a type of study design. ठीक है, बस तुम ये देखना exposure क्या है, outcome क्या है. Are you starting at the present time moving forward? Are you starting at the present time with cases and controls and moving backwards? Are you starting at the present time but you're going back, dividing into exposed, non-exposed and determining the outcome at the present time? It becomes retrospective cohort. Okay, let's see one more, everybody. This is a last year FMG question. A researcher wants to study relation of depression with history of social media usage. One group had social media users with depression and the other group had social media users without depression, guys. Which type of study design does this reflect? Good. Why are you writing a case control? Now see, again, depression is not very, although it's technically very common, but it's not diagnosed a lot. Okay, people don't go for checkups when it comes to mental illnesses. So what you can do is, you have a group of people. Okay, आपके पास एक population है, आप इसको divide कर दो into depressed. Okay, and you divide it into non-depressed. Okay, no depression, depressed and no depression. फिर आप पीछे जाओ, you go back and so your arrow is like this. You go back and ask about social media use. ठीक है, social media use, no use. यहाँ पे भी आप क्या करोगे? You ask about social media use, everybody, social media use and no use. So what have you done? You've gone backwards in time. Okay, so simple case control. Highly expected, both NEET PG as well as FMG, guys. ये question आराम से turn up कर सकता है, something to identify the type of study design. Okay. Now, one more. Let's quickly revise some points about confounding factors, everybody. So what's your answer here? Okay. Put in your answers, everybody. Okay, very good, everybody. So let us have a look at this question. Confounding factor. अब confounding factor क्या होता है everybody? What is a confounding factor? So confounding factor क्या होता है? What is confounding factor? It's a very important question which can come up in your exams. Confounding factor, like suppose I'm studying smoking and cardiovascular disease. So in this confounding factor क्या हो जाएगा everybody? It's going to become alcohol. Now why is alcohol a confounding factor? Alcohol confounding factor क्यों है everybody? Why is alcohol a confounding factor? Because a confounding factor is common to both exposure and outcome. ठीक है, first point. It is common to both exposure and outcome. That means alcohol is common to smoking also. Alcohol is common to CVD also. Those who smoke, they also drink. So it is common to both exposure and outcome. Then alcohol is also an independent risk factor for the outcome. ठीक है? It is also an independent risk factor for outcome. ठीक है, ये also क्या है? एक independent risk factor for the outcome है. Alcohol can also lead to cardiovascular diseases. ठीक है? Number 3, they are distributed unequally between the two groups. This is important. Unequally between the two groups. Okay. Number 4, you have both known and unknown confounders. हमारी study design में known and unknown confounders दोनों होते हैं guys. ठीक है. Then one of the most important technique which is matching. Matching eliminates only the known confounders, everyone. In which study design? That too in a case control study design. But if you look at a cohort study, ठीक है, cohort क्या करता है? Cohort eliminates both known plus unknown confounders. Sorry, randomization eliminates what? Randomization eliminates known plus unknown confounders both. Okay. So if you look over here, what is your answer? Factor is associated both with exposure and disease and is distributed unequally. Yes, very good. So option A becomes your answer, everybody. Clear? Easy question tha. But if somebody asks you, please remember, if somebody asks you, best technique to eliminate confounders, anyone? सबसे अच्छा टेक्निक क्या है to eliminate confounders, guys? What is the best technique to eliminate confounders? Can you put it in the comment section below, everybody? One second. Yes. What is the best technique to eliminate confounders, guys? सबसे best technique क्या है eliminate confounders के लिए? बहुत अच्छा पद्मा, everybody. Stratified randomization. Okay. What is it? Stratified randomization, guys. The best technique to eliminate confounders is stratified randomization. ठीक है? That's one of the best techniques to eliminate confounders. Some other techniques to eliminate confounders, guys. Some other techniques which can eliminate confounders. Can you name it for me? Some other techniques to eliminate confounders. Which other techniques batao to eliminate confounders? So some other techniques to eliminate confounders could be restriction. Okay, it is also regression models, guys. Restriction हो गया. We also have multivariate regression models. ठीक है? Multivariate regression models. These are also some of the techniques to eliminate confounders. ठीक है? Matching तो हमने पढ़ ही लिया है. Matching comes in case control study design. Plus इसके अलावा कोई और टेक्निक है? Standardization. Okay, standardization is also a technique to eliminate confounders. Clear? All right. Next, easy. Let's quickly see if you can mark this. Matching is done for removal of. This is also an important PYQ and a simple question which can come in your exams. Okay, very good. So we just did it. Matching is done for removal of good known confounders. Okay, easy. Bias. Let's quickly revise something about bias. Recall bias आपको किस study में दिखता है guys? Where do you see recall bias? Recall bias is mostly associated with case control study, cohort study, RCT or field trials. Where is it? Case control. So let's just quickly revise bias guys. A few bias. Bias क्या होता है everybody? It's a systematic error. Where does this error occur? It's a systematic error which occurs during the design of a study, or when we are conducting a study, or when we are doing an analysis of the study. Design, conduct and analysis. So because it's a systematic error which occurs during design, conduct and analysis, it results in a faulty association between exposure and outcome. So bias कौन conduct कर सकता है everybody? A subject, an investigator, all right, and also an analyzer. So exam mein what are the things which are expected guys? Subject bias is seen in recall bias, okay, which is seen in a case control study design. You can easily see this. Then you have another one, Hawthron bias. What is Hawthron bias and where do you see it? Hawthron bias is seen in a cohort study design. वो क्या है that जो if some participant comes to know that he or she is being observed, then what will they do? If they smoke, they will stop smoking. Investigator bias में एक होता है everybody, interviewer bias. Interviewer bias is again seen in case control study design. So I'm going to interview, ठीक है, case control. If I know that he or she is a case, so I'm going to interview them spending more time, ठीक है. So interviewer bias is a case control study design. Very good. Firdaus, everybody. Selection bias. Selection bias is again seen in a case control study design, okay. Do remember Bergsonian bias guys. Bergsonian bias is a type of selection bias only, okay. Then misclassification bias. I can wrongly classify the exposed into non-exposed groups, okay. Analyzer bias is the least reported because nowadays the investigator is only the analyzer. So analyzer bias the least reported. How do you eliminate bias? Please remember, blinding eliminates bias, not anything else. Blinding eliminates bias, okay. अगर आपको eliminate करना है confounders, you will go for randomization, matching, ठीक है. Blinding eliminates bias. There is one single blinding. Single blinding is what? The subject is unaware, ठीक है. Subject unaware है. All right. And what is double blinding everybody? What is double blinding? Double blinding होता है both subject plus investigator. They are unaware of the treatment, okay. So they are unaware. And what is triple blinding everybody? Triple blinding is nothing but subject, investigator plus analyzer, okay. Subject, investigator and analyzer all are unaware, ठीक है. But which is the most common form of blinding guys? सबसे common form of blinding क्या है? Most common form of blinding everybody. So the most common form of blinding is double blinding. And which is the best form of blinding? Best form of blinding however is triple blinding, ठीक है. Best form of blinding तो triple blinding है, but सबसे common form of blinding कौन सा है? That is double blinding. Is it clear everyone? So this becomes a very important question. Please don't forget the different types of bias, okay. For your information, bias को हम लोग non random error भी बोलते हैं, ठीक है. It's a systematic error or it's also a non random error, okay. Next, something which we can expect in exam, PQLI, okay. It's a highly repeated question. What is true about PQLI? Literacy rate, birth rate, life expectancy at birth. Okay, what is the answer over here? Very good. Padma has put in her answer. True about PQLI. So PQLI के लिए क्या सही है? Very good guys. So we'll just quickly revise life expectancy at 1 year, IMR and literacy rate. Now, this is one of the most frequently asked topics, everybody. So, let us just quickly revise this very simple topic. There is a concept of well-being, guys. ठीक है? Concept of well-being का एक होता है objective component, which is independent of our thoughts, and there is one subjective component. Okay, there is one objective component, one is subjective. Objective component is, just revise with me, standard of living, or you could also call it as level of living, guys. What is the most important indicator for this? It is GNP, gross national product. That's the most important indicator for standard of living or level of living. Subjective component में you have quality of life. In quality of life, please differentiate between HDI and PQLI. Now, how will you differentiate? HDI is life expectancy at birth. PQLI is life expectancy at 1 year, guys. ठीक है? Life expectancy at 1 year. Now, HDI में you have knowledge index. Okay? Knowledge index बोलो या education index बोलो. Knowledge index or education index, which is mean years of schooling plus expected years of schooling divided by 2. Here you have PQLI में क्या होता है, everybody? This is literacy rate. Okay, and since it's development depends on income. Here, since it was 1 year, तो यहाँ पे क्या हो जाएगा? Infant mortality rate. Current rank of scoring of HDI is 0 to 1. PQLI is 0 to 100. करंट स्कोर जो PQLI का है वो 65 है और HDI का करंट रैंकिंग कंट्री का 131 है, इंडिया का करंट रैंक. ऑलराइट, सो प्लीज डोंट फॉरगेट the difference between HDI and PQLI. Human Development Index talks about development, so you have to take into consideration income. Okay, so this is another important question which can come in your exams. All right, now in advanced epidemiological sorry, ये थोड़ा सा mix हो गया है question, guys. This question is in okay, in advanced model of triangle of epidemiology. Okay, in advanced model of triangle of epidemiology. Okay, so you have to quickly tell me agent is replaced by. Okay, agent is replaced by. Agent किससे replaced है? Determinant risk factors, causative bacterium, causative factors, or D, any of the above. किससे replaced है, guys? In advanced model of triangle of epidemiology, what is the answer? Causative factors. Very good. So your answer is causative factors. So just so you know, the first, there are different theories of disease causation. Okay, there are different theories of disease causation. So when you talk about different theories of disease causation, what is the first theory, guys? The first theory is theory of disease happens due to bad clouds. Okay, so that is miasma theory. Why is disease happening? Due to bad clouds. Okay, हमारे ऊपर bad clouds है. Then theory of spontaneous generation. What is spontaneous generation, everybody? Theory of spontaneous generation matlab disease happens on its own. So this was given by Aristotle, everybody. Third one, what is the third one, guys? Spontaneous generation के बाद what is the third one that you must know? Germ theory of disease. What is germ theory of disease, everybody? So germ theory of disease was this thing by Louis Pasteur. All right. उसके बाद हो गया epidemiological triad. Okay, what is epidemiological triad, guys? Epidemiological triad is an interaction between agent, host, and environment. Okay, this is an interaction between agent, host, and environment. Then when you talk about triangle, agent, host, environment, यहाँ पे triangle में क्या हो जाता है, guys? Time. Okay, so in epidemiological triangle, what is there? In epidemiological triangle, you have time, and there is one more advanced model. So in advanced model, agent is replaced by causative factor. Okay, agent is replaced by causative factor. यहाँ host भी है, यहाँ environment भी है. So what is this? This is nothing but advanced model of triangle of epidemiology. Okay, Two more theories which can come in your exam, everybody. Very good. Someone has written, Arpi has written web of causation. So what is the answer to this, guys? एक होता है तुम्हारा theory of multifactorial causation. What is multifactorial causation, guys? Theory of multifactorial causation was given by P10 Coffer. It tells us about the various possible causes. And web of causation. Web of causation tells us about the possible modes of transmission. ठीक है? It tells us about the modes of transmission, everybody. और ये किसने दिया था हमें? McMahon and Pug ने दिया था. All right, this was given to us by McMahon and Pug. So any of these theories can come. Please, please try to revise them along with me. This is very, very important. Okay, let's see your question. Okay. Here the question is, control of a disease aims at. What is control of a disease? So control of a disease aims at, anybody? Okay guys, control of a disease क्या aim करता है? At reducing. What are the correct options? So we'll just quickly revise the terms: control, elimination, eradication. So control of a disease aims at reducing the incidence of a disease, financial burden to the community, effect of infection including both physical and psychological, duration of disease and its transmission. Okay, some more answers. Let's wait for some more answers. क्या है इसका आंसर? Control. Control is everything, guys. Okay, this is directly from our textbook of Park, this statement. Control matlab reduce the incidence, reduce the financial burden to the community, reduce the effect of infection including both physical and psychological, also reduce the duration of disease and its transmission. When you do all this, the disease no longer remains what? Such that the disease no longer remains a public health problem. Okay, disease no longer remains a public health problem. Are you understanding? You have to reduce the incidence, you have to reduce the financial burden, the effect of infection, duration of disease and its transmission, so that the disease no longer remains a public health problem. All right, so all of the, now quickly tell me what is elimination, guys. एक चीज याद रखना, कंट्रोल में we want to reduce the transmission. ठीक है, control में we are reducing the transmission of a disease. But if I talk about elimination, guys, what happens in elimination? Elimination में हम लोग क्या करते हैं? We completely interrupt. Okay, interrupt the modes of transmission. हम लोग पूरी तरह से सारे modes of transmission को interrupt कर देते हैं. All right, in control you have to reduce, elimination you interrupt the modes of transmission, agent still exists. Good RP, okay. And elimination is a regional term, guys. ठीक है, एक particular region में होता है. So elimination is a regional term. But when I talk about eradication, everyone, what is eradication? Eradication is exterminate the disease agent. मतलब tear the agent from the root. Okay, tear the agent. Agent को root से ही निकाल लो. Tear the agent from the root. That is what is extermination of the. Yes, this is absolutely useful for UGC net also, Myra. Please do attend it. That is important. Okay, all these same questions come there also. And this is a global term, everyone. ठीक है, this is a global term. ठीक है, अगर मैं आपको बोलूं zero incidence of a disease X, if I say zero incidence of a disease X in India, all right, and if I give you another statement which says zero incidence, okay, if it says of a disease X, ठीक है, zero incidence of a disease in India, zero incidence of a disease X globally. So what will be your answer? So when I say zero new cases in India, I'm talking about a particular region. तो ये क्या हो जाएगा? Elimination. और अगर मैं बोलूं zero incidence of a disease X Globally, guys, what is this going to become? This is going to become eradication. Clear, everyone? Please remember these terms. Control में you are trying to decrease the modes of transmission. Elimination में completely interrupt the modes of transmission. And eradication में you're throwing away the agent from its root. Okay? So what is the answer over here? It's written causative agent present. Okay, causative agent present but no transmission. So what is the answer, guys? Causative agent है but कोई transmission नहीं है, तो ये क्या होगा? Causative agent present but no transmission. Elimination, which one? We have eliminator is from a regional term, no? सप्तर्षि region से तुम एक region से eliminate करते हो. Therefore, you say zero incidence of a disease in India. All right. So causative agent is present but no transmission. What is this, Anuradha? Think again. Causative agent है but transmission नहीं है. That means it is elimination. Okay. So control, elimination, eradication terms can come in your exams. Causative agent है but transmission नहीं है. Okay. No, it's not control. There is no transmission. Reduce transmission is, if you reduce transmission, everybody, reduce transmission is control. But अगर मैं बोलूं no transmission, guys, बिल्कुल transmission नहीं होगा, that is elimination. Okay. And if I say no agent, that is eradication. Clear? Umaira, did you understand, dear? All right. Chalo. Some questions have gone this thing. Here the question says, a person is going for self-health checkup to a hospital as his father died last week due to ischemia. All right. So which level of prevention is this? Which level of prevention is this? Can you tell me? A person is going for self-health checkup to a hospital as his father has died last week due to ischemia. So which level of prevention is this? Okay, some other answers, please. Very good. Like we have learned in our classes also, guys, अगर कोई person जा रहा है self health checkup to a hospital because his father has died last week due to ischemia, now obviously he will go to make an early diagnosis. Now he might have all the risk factors present like his father. He might be smoking, he might be drinking, he might be eating junk food. So why has he gone to the hospital? To make an early diagnosis. कि कहीं उसमें disease तो नहीं शुरू हो गया, ठीक है? So a person who's going for self-health checkup to a hospital as his father has died last week due to ischemia is to make an early diagnosis of a disease. Okay? So please remember any form of health checkups. Okay? When you go for any form of health checkups or you are attending health camps, okay, all these are to make an early diagnosis. जैसे school health checkup. Now, what is school health checkup? School health checkup is also to make an early diagnosis. So, this becomes which level of prevention? Secondary level of prevention. Okay. So, please remember these things. Alright. यहाँ पे याद रखना, primordial level of prevention happens before risk factors. Okay. Before risk factors is primordial. And what is the mode of intervention? We'll try to educate the people. So you achieve primordial level of prevention by health education. What is primary level of prevention, guys? Risk factors present. Okay. Risk factors present but disease not started. Has the disease started? Disease has not started. So here we can do two things. What do we do here, everybody? We do health promotion and हम लोग क्या कर रहे हैं? Health promotion and specific protection, everybody. ठीक है? But when we talk about secondary level of prevention, guys, secondary मतलब क्या होता है? Disease started but no complications. So since there are no complications, we will try to make an early diagnosis. Okay. All right. So that we can find the disease and cure it. यहाँ पे आ जाता है आपका screening and all. Early diagnosis and treatment. While the person is in the subclinical stage, you try to make a diagnosis and treat the person. Tertiary क्या होता है, everybody? Tertiary matlab disease has progressed to a stage of complications. That means, what does this mean? Disease has progressed to a stage of complications matlab disease complications are present. Okay, complications present. Yes, ischemic, no. Thus, he is subtertiary. Subtertiary, that person is worried that maybe the disease has started in his body. Whenever you go for a checkup, you want to rule out a disease. So that is what he has gone to the hospital to make an early diagnosis. He has the same risk factor as his father. So he wants to see कि कहीं उसमें disease तो नहीं शुरू हो गया है. So for that, he goes to the hospital to make an early diagnosis. In that case, here the answer is secondary. Okay, you always visit a hospital or someone to make an early diagnosis, whether you are developing a disease or not. That he does not have signs and symptoms, but we want to find out the disease before the person goes on to develop signs and symptoms. So, okay, टर्शरी में कॉम्प्लिकेशंस है तो ये क्या हो जाएगा एवरीबॉडी डिसेबिलिटी लिमिटेशन एंड व्हाट विल इट बी disability limitation and rehabilitation. Clear? Disability limitation and rehabilitation. Look at this one. यहाँ पे लिखा हुआ है use of condoms guys, use of condoms to protect against STD. What is this? Use of condoms to protect against STDs. ये क्या होगा? You're using condoms to protect against sexually transmitted disease. Now just tell me, is the risk factor over here or not? Has the disease started? No. Disease has not started. We want to protect against STD. So risk factor is present. What is the risk factor? People will have sexual intercourse, है ना? Sexual intercourse तो होगा ही. People will have sexual intercourse, right? But the disease has not yet started, and we are using condoms to protect against STD. So it is a form of specific protection. All right, this can come in your exams. Chalo, now can anyone tell me what is A, what is B, what is C, what is D, and what is E? And which chapter is this that we are talking about? Here, what are we studying, everybody? A, B, C, D, E में क्या पढ़ रहे हैं हम लोग? So here we are studying what is known as natural history of a disease. Okay, natural history of a disease. Natural history of a disease मतलब how a disease evolves or progresses. ठीक है? कैसे एक disease evolve कर रहा है या progress कर रहा है without any intervention. So what is A? A क्या है? You have to tell me in the comment section. I'm not giving you any option over here. A क्या है? What is A? Before A, you have a stage of susceptibility. So where do you have this stage of susceptibility, everybody? No, A is not. Stage of susceptibility happens in the environment. Okay, here you are exposed to risk factors. Okay, here you are exposed to risk factors. No, this is not the diagram of screening, Radhika. We'll be looking at the diagram of screening also. A क्या है? A is exposure. So you have a stage of susceptibility which is happening in the environment when we are exposed to the risk factors. A क्या होता है? Exposure. After A, what do you have? A stage of subclinical disease. Okay, so what is B? B is pathological changes have started. Okay, so we should be able to diagnose a disease when the person is in the subclinical phase. Subclinical phase matlab the person does not have any signs and symptoms right now. So subclinical disease ka stage matlab this is a stage of what pathogenesis, everybody? This is a stage of early pathogenesis. Okay, then what is C, guys? What is C? C is, what is it? Appearance of first sign and symptoms. Okay, sign and symptoms. So after signs and symptoms come D for diagnosis. D becomes your usual time of diagnosis. Okay, usual time of diagnosis. And what is the stage of clinical disease, guys? Stage of clinical disease is divided into ये early pathogenesis था, ये late pathogenesis है. Okay, and what is E? E is of course the outcome. Okay, what is eventually going to happen? See, this is a diagram of natural history. How a disease evolves or progresses without any intervention. ठीक है? अब यहाँ पे तुम्हारा A क्या हो गया? Before A, you are exposed to the risk factors in the environment. So, which level of prevention can work over here? Primary. Why? Because we are exposed to the risk factors. फिर एक्सपोजर के बाद बी में क्या होता है? पैथोलॉजिकल चेंजेस स्टार्ट इन आवर बॉडी. सो हियर यू कैन अप्लाई screening, okay, the secondary level of prevention. Make an early diagnosis and treat. Now clinical disease के बाद आप यहाँ पे क्या पढ़ सकते हो? Stage of recovery, disability or death. Here you can apply what is known as tertiary level of prevention. Okay, we can apply tertiary level of prevention. Is that clear everyone? Will you remember this natural history? Please remember ये क्या है ये सारे phases. So A is exposure, B is pathological changes guys, B is pathological changes, C क्या होता है? C is the first, C is what everybody? Signs and symptoms start to come. ठीक है? Appearance of signs and symptoms. What is D? D for diagnosis. So usual time of diagnosis is D and E is your outcome. ठीक है? So here we are studying natural history. Which is the study design which best establishes natural history? We just did it before. The best study design to establish natural history, everybody, is a cohort study design. So this is simply showing us how a disease is evolving or progressing without any intervention. Okay? Susceptibility is happening in the environment, then in the body, pre-pathogenesis and pathogenesis phase, and finally it's leading to recovery and death. Okay? Recovery, death or disability. Alright? So it is the same thing which we have done. This is A, this is B, this is C, this is D, this is E. E is the outcome everybody. ये हो गया तुम्हारा primary level of prevention. यहाँ से यहाँ हो गया तुम्हारा secondary and tertiary level of prevention. Okay? Alright. What does 11 stand for? Quickly, let's see some of the points about ICD 11 guys. What is the meaning of 11 over here? 11 क्या है guys? What is the meaning of 11? 11 मतलब International Classification of Diseases. 11th matlab addition or revision. So what are the questions that come from ICD 11 everybody? So ICD 11, please read some important points over here. ICD 11 was released in 2018 by WHO. 3 volumes, 26 chapters with V and X guys. 3 volumes, how can you remember? 3 volumes everybody, कैसे आप remember कर सकते हो 3 volumes? Now when you read a book, you first have a tabular list. Starting के पेज में एक टेबल होता है, पीछे there is a reference guide which is given in the form of alphabetical index. So this is TRA, isn't it? When you open a book, first page is your tabular list, ठीक है? उसके बाद एक reference guide होता है पीछे, an alphabetical index. You could be asked both NEET PG FMG, this could be an MCQ. What is chapter 6? Mental, behavioral, neurodevelopmental orders, and chapter 26 is traditional medicines. How is ICD-10 better over ICD-11? It is allowing you to make international comparisons. Okay, so that's a very important question. Please remember this. Chalo, let's see this one. An epidemic is the rapid spread of disease to large number of people in a given population within short period of time. A well of contaminated water resulting in an epidemic of acute watery diarrhea is a typical example for. So let's quickly revise some types of epidemics, guys. What is the answer to this question? Okay, some of you are writing D. Why have you written D? What is given? Okay. Is C the answer or D the answer? Everybody think carefully. Question क्या पूछ रहा है? A well of contaminated water. So is it propagated? Is it common source single exposure or is it common source continuous exposure, guys? What is the answer over here? Will you be drinking a well of contaminated water? So is that well a source of infection only once? Will I not go to the well again? Will I not be going to the well again? What happened? Okay. Will I not be going to the well again? 1 second, guys. Okay, so will I be going to the well again? Of course I'll be going to the well again, है कि नहीं? हम लोग well को फिर से well के पास तो जाएंगे ही, all right? So what is the answer over here? Yes, the answer over here becomes common source continuous exposure epidemic. ठीक है, क्या हो जाएगा आंसर यहाँ? Common source continuous exposure epidemic. Now let us quickly revise some of the very important terms over here. ठीक है, सबसे पहले तो what is an endemic? What is an endemic? Endemic का मतलब होता है constant presence of disease in a population. ठीक है, constant presence of disease in a population is endemic. What is epidemic, guys? Epidemic मतलब होता है disease occurs in excess of normal expectancy. ठीक है, excess of normal expectancy. So when it occurs in excess of normal expectancy मतलब mean plus 2 standard deviations or more than 80% of expected frequency. ठीक है, more than 80% of expected frequency. That is an epidemic, all right. Also, if like polio does not occur in India, ठीक है, so even if a single case of an eliminated disease, एक भी केस आता है ऑफ एन एलिमिनेटेड डिजीज, दैट इज ऑल्सो एन एपिडेमिक. ओके, लाइक पोलियो का एक भी केस इंडिया में आ जाता है, वन केस ऑल्सो कम, इट्स एन एपिडेमिक. और single case of an exotic disease. What is single case of an exotic disease, guys? What is an exotic disease, everybody? Exotic disease हो गया जैसे yellow fever. So single case of an exotic disease, अगर yellow fever का भी कोई एक केस इंडिया में आ जाता है, what is that? That is an epidemic. Okay, so epidemics are what? Single case of an exotic disease, that is also an epidemic. All right, like yellow fever. Okay, so endemic, epidemic you must know. Pandemic क्या होता है, guys? Pandemic is worldwide distribution. Okay, pandemic is worldwide distribution. Worldwide distribution मतलब क्या होता है? The disease is crossing more than 2 continents, okay, or more than two WHO specific regions. ठीक है, more than 2 WHO specific regions. दो से ज्यादा continent cross हो रहा है या दो से ज्यादा regions cross हो रहा है. Now here the question was epidemic. Okay, so what are the types of epidemics that you must know? Number one, the first type of epidemic, guys, जो हमें पता होना चाहिए is a common source, or you could say more specifically point source single exposure. Okay, point source single exposure. So when I say common source or point source single exposure, the exposure is only once, like in food poisoning. Okay, today we go to a party, all of us have food there and our stomach goes upset. उसका स्लाइड कैसे होता है? ऐसे होता है. ठीक है, रैपिड राइज, रैपिड फॉल इन केसेस. All the cases occur within one incubation period of the disease. This is explosive in nature. So the points for this is what? Rapid rise and rapid fall. Okay, rapid rise and rapid fall in cases. Number two, what is this? All the cases occur within. All cases occur within what? All cases occur within one incubation period of the disease. Okay, all cases occur within one incubation period of the disease. सारे cases एक ही incubation period में occur कर रहे हैं. Then it is explosive in nature. Why is it explosive in nature? Because there is clustering of cases in one incubation period. No secondary waves, guys. यहाँ पे कोई secondary waves नहीं. Okay, that is what is point source single exposure. But now look at this epidemic. इसमें क्या हो रहा है? Yeah. What is this, everybody? This one is common source but multiple exposure. कॉमन सोर्स मल्टीपल एक्सपोजर बोल सकते हो आप इसको, या आप इसको और क्या बोल सकते हो? continuous exposure. Okay, the exposure is continuous. Now how can you make out that the exposure is continuous? यहाँ पे क्या होगा? What are the points? Gradual rise. Okay, gradual rise, gradual fall. Then the cases occur over, this is actually like this guys, ऐसे, ठीक है? So gradual rise, gradual fall, cases occur over more than one incubation period. Cases occur over more than one incubation period of the disease. ठीक है, एक से ज्यादा incubation period of the disease पे occur करते हैं. So this is what? This is explosive in nature. Yes, this is explosive in nature. And these things, यहाँ पे जो ऐसे ऐसे करके peaks बनेंगे, these are known as what? Secondary waves. So you have multiple secondary waves in a common source continuous exposure. Is it clear? ठीक है, so cases occur over more than one incubation period of the disease. So this is explosive in nature. It has a number of secondary waves. And एक और point क्या है, ये देखो, ये क्या है? This is a prolonged plateau phase. ठीक है, what is this? This is prolonged plateau phase. ठीक है, gradual rise, gradual fall, cases occur over more than one incubation period of the disease, so it is explosive in nature. We have multiple secondary waves over here. और यहाँ पे एक और चीज क्या है? Prolonged plateau phase. So when you are drinking water from a contaminated well, it's a continuous source of infection. From an infected milkman, it's a continuous source of infection. तब तक हम उस source of infection को ढूंढ के ट्रीट नहीं कर लेंगे, the infection is going to remain there guys. Okay, so whether we are drinking from contaminated well or we are drinking from taking milk from an infected milkman, it is an example of continuous exposure. But what is this guys? ये क्या है? Now look, ये क्या है everybody? What is this? This is propagated epidemic. Okay, what is propagated epidemic? Very good. Propagated epidemic क्या होता है? Propagated epidemic shows person to person transmission. क्या दिखाता है? Person to person transmission. All right, now if you look at this, it's not a smooth rise. Okay, it's not a smooth rise. Okay, it's a bumpy rise. कैसा rise है? Bumpy rise है, smooth rise नहीं है, और एक बहुत ही छोटा सा plateau phase है. Okay, so what do you have? It is smaller plateau phase. Okay, this is smaller plateau phase guys. Okay, smaller plateau phase. So this is propagated epidemic. Like you could have epidemics of hepatitis A, ठीक है, epidemics of polio, TB, all this. So see, जब भी आपको ग्राफ मिलेगा ना, just see is it a smooth, is it a rapid rise and rapid fall? If it's a rapid rise and rapid fall, it's single exposure point source. If it's a gradual rise, prolonged plateau phase है और एक gradual fall है everybody, वो है तुम्हारा कौन सा? This one, common source continuous exposure. But if the rise is not at all smooth, can you see the rise over here? It's a bumpy rise, it's not a smooth rise. और यहाँ पे आपको क्या दिख रहा है? एक छोटा सा plateau phase दिख रहा है, ठीक है, and a gradual fall. So this is person to person transmission. Intermittent exposure could be from a continuous source only. Okay, in intermittent you have small like this. Okay, एक सेट ऐसे हो सकता है, एक सेट ऐसे हो सकता है, एक ऐसे हो सकता है. All right, this is what is intermittent exposure. Am I clear? What is it? What is intermittent exposure? ठीक है, like we are eating contaminated food products. Okay, so वो तुम्हारा intermittent exposure हो जाता है. Is it clear everybody? Did you understand this point? ठीक है, this is an important question which can turn up in your exams. Okay, let's go to the next one. What is correct regarding administration of SA 1414-2 vaccine? Now, one of the vaccine questions will definitely come, guys, exam में. तो एक vaccine revise करना बनता है, ठीक है. अभी हमने epidemiology, concept of health, disease distribution, all these we have revised. Okay, so what is the correct rule regarding administration of SA 1414-2 vaccine, guys? Anybody? गुड। सो SA 14-14-2 सबसे पहले तो कौन सा वैक्सीन है? SA 14-14-2 इज अ Japanese encephalitis vaccine. Okay, what is SA 14-14-2 guys? SA 14-14-2 is a Japanese encephalitis vaccine, है ना? This is a Japanese encephalitis vaccine. Now Japanese encephalitis vaccine, let's do a few points. So this is which type of vaccine? JE vaccine is available as a live vaccine also. ठीक है, this is a live vaccine. SA 14-14-2 ये क्या है? This is a live vaccine guys. This live vaccine is being used in our NIS. NIS मतलब क्या हो गया? What is NIS? It means this is being used in our National Immunization Schedule. Okay, we are using SA 14-14-2, the live vaccine in our National Immunization Schedule. Okay, that's another question that you must remember. We have killed form also. Killed form of Japanese encephalitis is killed form of JE vaccine. So what are the killed form of JE vaccine, guys? Killed form of JE vaccine is Nakayama and Beijing. But this killed form of JE vaccine is not used in NIS. Okay, it is not used in NIS. Now the first question, type of vaccine, it's a live vaccine. Okay. Then when do you use it, guys? Schedule. The best thing that Japanese encephalitis is also being used at 9 completed months. Okay, at 9 completed months, you are also using measles rubella vaccine. So 9 completed months में Japanese encephalitis का first dose पड़ता है, and at 16 to 24 months, guys, we give Japanese encephalitis second dose. Now, what is the route? Like I've taught you NIS that both the vaccines, there are two vaccines which are being given at 9 completed months, J and measles. Both are given by subcutaneous route. And what is the dose for these vaccines, guys? Dose क्या होता है everybody? What is the dose? What is the dose? Dose is your 0.5 ml. ठीक है? In case of delayed immunization. Now remember, Japanese encephalitis is endemic in certain places in our country. Yes. Which arm? Very good. Arm, you can remember this side. You can remember this side. Side is the left upper arm. How can you remember this? Now see, measles rubella is also being given at the same time at 9 completed months. So measles rubella from the word R is given in the right arm, और Japanese encephalitis उस time कहाँ पे दी जाएगी? Same time में it's being given in the left upper arm. ठीक है? All right. Now after this, in case of delayed immunization, Japanese encephalitis vaccine can be used up to how many days? Can be given up to how many years? In case of delayed immunization. In case of delayed immunization, you can give it up to 15 years. So what is the answer over here? 0.5 ml subcutaneous dose. Now I just want to ask you over here, does Japanese encephalitis follow open vial policy? Anybody? क्या Japanese encephalitis vaccine open vial policy follow करता है? Anybody? What is open vial policy? No, it does not follow. Open vial policy क्या होता है? Once you've opened the vaccine vial, guys, you can use it up to 28 days. Okay, but JE does not follow. Why? Because JE is a reconstituted vaccine. ठीक है? It is available in which form? It is available in a powder form. So you have to add a diluent to it to make it a liquid. ठीक है? It is available in a powdered form. So हमें एक diluent use करना है to make it a liquid. What is the diluent over here? Phosphate buffer. Therefore, since you are making it into a liquid, guys, Japanese encephalitis vaccine, everybody, can be used up to more precisely 2 hours only. All right, 2 hours only. Very good. Ashish, Arpi, Anuradha, Vinith, everybody. ठीक है? So please remember, other vaccines also, I'll make a list. Other vaccines which do not follow open vial policy. Other vaccines which do not follow open vial policy, guys. क्या क्या vaccines हैं which do not follow open vial policy? BCG, measles, ठीक है, measles, rubella. Third one, Japanese encephalitis. Fourth one, yellow fever. All right, all these vaccines do not follow open vial policy. Guys, rotavirus vaccine also does not follow open vial policy. Okay, rotavirus vaccine also does not follow open vial policy. These have to be used up to 4 hours. Rotavirus also, Japanese encephalitis 2 hours, yellow fever half an hour. All right, so this was about JE vaccine. All right, vaccines which should, now this was asked severe egg allergy में कौन सा vaccine नहीं देना चाहिए? Can you tell me severe egg allergy which vaccine should not be given? Anybody? Severe egg allergy, which vaccine should not be given? Influenza, rabies, measles, yellow fever, rubella. आ सकता है. Severe egg allergy में कौन से vaccines आप नहीं देते हो guys? In severe egg allergy, anyone? Very good. Let's see some more answers. Measles you can give in egg allergy. Both A and E. Very good. Influenza and you cannot give influenza A and D. Yes. Yellow fever. Alright. So you cannot give influenza and you cannot give yellow fever vaccine in case of severe egg allergy guys. Okay. ये आप नहीं दे सकते हो. So just let's have a look at some adverse events guys. Influenza में you can report Guillain-Barré syndrome. Okay, Guillain-Barré syndrome. Then OPV paralysis can come. You all know OPV is CVDPV and VAPP guys. ठीक है, CVDPV is due to type 2 component. VAPP is due to type 1 component. Hepatitis B has come as an MCQ. Hypersensitivity. Measles has come as an MCQ. Toxic shock syndrome, very important. Rare cases में it also leads to SSP. Rotavirus guys, intersusception. Okay, rotavirus is intersusception guys. Guys, please remember, like you have rotavirus, okay, you have pentavalent. You should give them up to 1 year. Pneumococcal. In case you don't give the dose of first dose also, अगर आप 1 साल तक नहीं देते हो, ठीक है, if you do not give the first dose also till 1 year, then you cannot give these vaccines. But if you like rotavirus, if you give at least the first dose till 1 year, you can continue with the remaining schedule. Okay, so first dose rota, penta, PCV, okay, IPV, everything should be given up to 1 year. Pertussis में we all know hypotensive HHE, inconsolable crying, ठीक है, inconsolable crying हो जाता है. Then HHE is hypotensive hyporesponsive encephalopathy. BCG, everybody we all remember BCG up to 1 month. BCG का कितना डोज देते हैं? Up to 1 month. Dose is 0.01 ml. 0. Yes, what is 0.05 ml intradermal? After 1 month, if you want to give BCG, what is the dose? 0.1 ml intradermal. If you give it before 1 month, 0.1 ml, it will lead to lymphadenopathy. MMR is thrombocytopenia. Clear everyone? Some of these questions can turn up in your exam. Adverse events, please don't forget about adverse events. कुछ important है, intersusception and all those that can come in your exams. ठीक है? Strains में let's quickly revise. CYD TDV. Now it's written D, so this is dengue. Okay, CYD TDV is dengue. Then you all know this one, Danish 1331. I'm sure I don't have to make you remember this, BCG. Okay, then two vaccines which have a very term. Not that important, but it can come in your exams. All right. So these are some of the important strains of vaccines that we have revised. Okay, yes. One more, influenza. Killed influenza का क्या है everybody? Killed influenza A7 California, please remember this, 2009. Okay, there was an epidemic of this thing 2009 में, so A7 California 2009. Okay. Next question, let's have a look. You are posted at a PHC and you have to ensure routine vaccination processes carried out smoothly. All of the vaccines are given at 16 to 24 months except. बताओ इसका आंसर. 16 to 24 months. So this is simply revision of NIS. Okay, so you're posted at a PHC and you have to ensure routine vaccination process is carried out smoothly. All of the following are given. Very good, Ashish, Radhika, Tilly, everybody. So we all know PCV का booster 9 completed months में मिलता है. So let's quickly revise national immunization schedule, guys. We'll just look at the vaccines once. At birth आप कब देते हो, क्या देते हो? BCG, OPV का 0 dose, and you also give what? Hepatitis B. You will tell me what are the vaccines that we give. Hepatitis B ka birth dose. Then what else do you give at 6 weeks, 10 weeks and 14 weeks, guys? So write all those which are given at 6 weeks, 10 weeks and 14 weeks. क्या क्या देते हो आप? OPV1, OPV2, OPV3. ठीक है, फिर आप क्या देते हो? Penta 1, you also give Penta 2, you also give Penta 3. Then what do you give? Rotavirus 1, Rotavirus 2, Rotavirus 3. ठीक है, उसके बाद यहाँ देते हो फ्रैक्शनल IPV1, fractional IPV2 and PCV1, PCV2. Okay, PCV1 and PCV2. Then at 9 completed months, guys, what do you give at 9 completed months, everybody? 9 completed months may we are giving the first dose as measles rubella vaccine. Measles is now given as measles rubella vaccine. First dose Japanese encephalitis ka first dose, PCV ka booster, everybody. Okay, and here only we start vitamin A. Vitamin A is started at 9 completed month. You give 1 ml or 1 lakh international unit. Thereafter, what do you do? Thereafter, every 6 months, okay, every 6 months till 5 years of age. What are you going to give till 5 years of age, guys? You are going to give what? You are going to give 2 ml or 2 lakh international unit. Okay? Then you have 16 to 24 months, guys. MMR is not given. 16 to 24 months में आप क्या देते हो? Measles rubella का second dose, JE का second dose and OPV का first booster. ठीक है, OPV booster 1. All right, and what else do you give? OPV का booster 1 आप दे रहे हो, ठीक है, you give the first booster of OPV and you also give which booster now? DPT का first booster. Okay, we are also giving DPT का first booster. Then 16 to 24 months के बाद you have to give at 5 to 6 years, guys. So what are you giving at 5 to 6 years? You're giving DPT का second booster. And then finally you give at 10 years and you give at 16 years. So यहाँ पे आप क्या दे रहे हो? TD1 and TD2, everybody. Clear? ठीक है, this is the schedule. Please remember it. It's very, very important. Remember one more thing. OPV vaccine 2 drops दी जाती है. Rotavirus OPV vaccine. One second. I'll just write one thing. Oral route से you are giving OPV and rotavirus. OPV के आप देते हो कितने drops? 2 drops. Rotavirus के आप देते हो 5 drops. Okay. Intradermal you are giving BCG and fractional IPV. BCG is left arm and fractional IPV is right arm. Fractional IPV is 0.1 ml intradermal. And we all know subcutaneous हम लोग कौन सा दे रहे हैं? Measles, rubella we are giving subcutaneous and J. Both of them are given at 9 completed months. ठीक है? Measles, rubella and J दोनों 9 completed months में देते हैं. And rest all the vaccines we are giving by intramuscular route. The T series vaccine we are giving by intramuscular route. PCV also intramuscular route. Clear, everybody? An intramuscular route we are trying to give it in the legs. ठीक है? So this is the schedule. I'll also make one more list over here, guys, for delayed immunization. Just have a look at it. Delayed immunization, guys, if we talk about delayed immunization, till 1 year you can give which vaccines? All those that you were giving at 6, 10, 14 weeks. BCG, Penta, rotavirus, IPV, PCV. If you want to start rotavirus vaccine, please start the first dose at least by 1 year. Then you can continue the schedule. क्योंकि अगर आप 1 साल के बाद start करोगे, it lead to interception. ठीक है? उसके बाद 5 years तक आप क्या दे सकते हो guys? What are the 5 years vaccine? Measles, rubella you can give. Of course you can give vitamin A, you can give OPV. ठीक है, hemophilus influenza B separately you can give it till 6 years. ठीक है, उसके बाद तुम्हारा आता है 7 years. Till 7 years, guys, you can give DPT vaccine. All right, DPT vaccine is given everybody till 7 years. And what about till 15 years, guys? I'm sorry, 7 years तक DPT vaccine दे सकते हो. 15 years तक we just saw J vaccine. All right, so these could come. This was, however, a question of routine immunization. Okay, what was it? A question of routine immunization. This was a question, guys, of routine immunization. Okay. Okay, moving to the next one. Yes, just like natural history of the disease, you can get this image. ये किसका image है? Screening का. This is an image of lead time, guys. Okay, so can you tell me the answer? Which point is usual time of diagnosis over here, guys? Okay, now देखो A क्या होता है? A is the disease onset. Okay, disease, the agent has entered, exposure has happened, disease has started. B क्या होता है everybody? What is B? B is the first possible point of detection. What is B? B is the first possible point of detection. What is X, guys? B is the first possible point of detection. X क्या है? What is X, everybody? X क्या है? X is the critical point. Critical point of detection. And what is Y, everybody? What is Y? Y is the usual time of detection. Y is the usual time of detection. What does this usual time of detection means? At B, first possible point of detection मतलब no signs and symptoms. ठीक है, कोई signs and symptoms नहीं है. All right, no signs and symptoms at point B. Is it clear? और Y क्या है? Usual time of detection when you have signs and symptoms. ठीक है, आपको क्या आ रहे हैं? You have signs and symptoms. All right, you have signs and symptoms, so that becomes the usual time of detection, everybody. So now what is lead time, guys? Lead time क्या है? The time interval between the first possible point of detection, this and Y. ठीक है, so usual time of diagnosis is Y. This is lead time. So what is lead time? Instead of detecting a disease at point Y, when you develop signs and symptoms, you are detecting it at point B. जब कोई signs and symptoms नहीं है, but the disease might have started in your body. See, we want to make a see. We are concerned with finding this hidden portion. ठीक है, हमें ये hidden portion पता करना है iceberg का. Right? We are concerned with finding this hidden portion. So what are we going to do, everybody? We have to apply a screening test when the person does not have signs and symptoms. The disease might have started, but person को signs and symptoms नहीं है अभी तक. So we have to identify before signs and symptoms come. So instead of applying the test at Y, I'm applying the test at B. So B to Y, everybody, is what? B to Y is lead time, okay? And B to X क्या है, everybody? B to X is screening time. Meaning, if you want to get an advantage of a screening test, अगर तुम्हें किसी screening test की advantage लेनी है, at least apply the screening test till point X. Because if you apply it beyond X, it will not give you added advantage, okay? So if you want to get the, like, it will not give you substantial advantage. The purpose of screening is to make an early diagnosis and provide treatment, है कि नहीं? Screening हम इसीलिए तो करते हैं. समझ में आ रहा है? स्क्रीनिंग हम इसीलिए करते हैं. सो अगर मुझे बहुत ज्यादा एडवांटेज भी चाहिए तो मैं पॉइंट एक्स कर. ठीक है, everyone understood? Okay, this is again an important question which can come in your exams. All right, let's see what is your answers over here. Out of 1,000 population, we'll just quickly revise the formulas, guys. Out of 1,000 population, a screening test found 90 to be diabetic correctly, then a gold standard test found 100 to be diabetic. What is the sensitivity? So it's very simple. What is sensitivity? Ability of a screening test to identify correctly what? Identify correctly all those who have the disease. ठीक है? So suppose if here I have disease, ठीक है? Yes, no. All right. और यहाँ पे मैं लगाऊंगी screening test yes, no. So what is this, guys? This is A, this is B, this is C, this is D. So disease is present and screening test is also positive. So this is TP. Disease is not present but screening test तो positive बोल रहा है, disease है नहीं. So this is FP. Please don't मग अब दिस, इसको मेमोराइज मत करना, इसको समझो. डिजीज है बट स्क्रीनिंग टेस्ट नेगेटिव बोल रहा है तो फॉल्स नेगेटिव. डिजीज नहीं है और स्क्रीनिंग टेस्ट भी नेगेटिव बोल रहा है, सो ट्रू नेगेटिव. All right. So sensitivity is ability of a screening test to identify correctly all those who have the disease. So how many have the disease? A plus C, right? So how many have TP plus FN? उसमें से screening test has identified in TP multiplied by 100. And what is specificity, everybody? Specificity क्या होता है? Can you tell me? It is very simple. Ability of a screening test to identify correctly what? To identify correctly all those who do not have a disease. ठीक है, जिनके पास एक डिजीज नहीं है. So over here, if you look at this, how many don't have a disease, guys? How many don't have a disease? FP plus TN. ठीक है, और स्क्रीनिंग टेस्ट ने इस पे किस पे कितनों में करेक्टली आइडेंटिफाई किया है? इन TN. Okay, multiply by 100. Now what had I taught you about PPV? PPV is all positives. Like if you come a screening test positive, तुम screening test positive आयो, क्या वाकई में तुम में disease है? Even if you've come a screening test positive, do you actually have the disease? Is PPV. So out of all those tested positive by a screening test, here screening test yes, TP plus FP, how many actually have the disease? TP. So all positives. Out of all those tested negative by a screening test FN plus TN. So how many actually, out of all those tested negative by a screening test, how many actually do not have the disease? TN. You might have come positive by a screening test. So if you've come positive by a screening test, do you actually have the disease? Is PPV. You might have come negative by a screening test. You actually not have the disease. Is NPV. Okay. So these are very simple formulas. PPV में all positives है, NPV में all negatives है. So look over here. Do you need to draw 2 by 2 table? I don't think so. There's 1,000 population. A screening test found 90 to be diabetic correctly, but gold standard found 100. So gold standard is telling you the total disease, guys. So gold standard is telling me total disease. So what is this total disease? Look, it is this one. Gold standard is telling A plus C is 100, which is TP plus FN is 100. But screening test is only telling me in A. Screening test is only telling me in 90. Okay, so that is true positives. So what is sensitivity, everybody? Ability of a screening test to identify correctly all those who have the disease, guys. So how many have the disease? 100. उसमें से screening test has identified it in 90. So answer becomes 90 by 100. Is it clear? How will you remember this? It's not at all difficult, guys. TPV में सारे positives हैं, NPV में सारे negatives हैं. Which is the most useful property of a screening test? If I ask you, most useful property of a screening test. ठीक है। सबसे यूजफुल प्रॉपर्टी ऑफ अ स्क्रीनिंग टेस्ट एवरीवन इज सेंसिटिविटी, ठीक है। दैट्स द मोस्ट यूजफुल प्रॉपर्टी ऑफ अ स्क्रीनिंग टेस्ट। बट इफ आई आस्क यू डायग्नोस्टिक एक्यूरेसी, ठीक है, डायग्नोस्टिक एक्यूरेसी आपको कौन बताता है? प्रिडिक्टिव वैल्यूज, ओके, इट कुड बी एनीथिंग, पीपीवी एज वेल एज एनपीवी, बट मोस्ट यूजफुल प्रॉपर्टी ऑफ अ स्क्रीनिंग टेस्ट गाइज इज सेंसिटिविटी, ठीक है, which can come in your exam. For any screening test, you should have a good sensitivity. Sensitivity, specificity inversely proportional है, तो किसी भी screening test के लिए अच्छी sensitivity होनी चाहिए और fair specificity होनी चाहिए. चलो ये बताओ. Due to an effective program, the prevalence of an infectious disease in community has been reduced by 90%. A physician continues to use the same diagnostic test for the disease that she has always used. How have the test characteristics changed? Anybody? Now here it's a direct question which is many times asked. You have to know what is the relationship of prevalence with प्रिडिक्टिव वैल्यूज। आपको ये जानना है रिलेशनशिप ऑफ प्रेवलेंस विथ प्रिडिक्टिव वैल्यूज गाइस। सो व्हाट इज द रिलेशनशिप ऑफ प्रेवलेंस विथ प्रिडिक्टिव वैल्यू? हियर इट्स अ वेरी सिंपल थिंग। इफ द प्रेवलेंस इंक्रीजेस, पीपीवी इंक्रीजेस, ठीक है, इफ द प्रेवलेंस इंक्रीजेस, NPV decreases. So PPV is directly, this has come many times guys, directly proportional to prevalence, but NPV is indirectly proportional to prevalence. ठीक है, पीपीवी तो डायरेक्टली प्रोपोर्शनल है प्रेवलेंस के लिए, बट एनपीवी इनडायरेक्टली प्रोपोर्शनल है प्रेवलेंस. So here the prevalence of an infectious disease has reduced by 90%. So if prevalence decreases, what is going to increase? Negative predictive value. ठीक है, negative predictive value increases. Is it clear everyone? This is important one क्योंकि prevalence घट गया. They asked this. It is many times repeated guys. Okay, this is repeated many times. It's a repeated question. Many times repeat हुआ हुआ है. PPV is directly proportional to prevalence. NPV is indirectly proportional to prevalence. Please remember these things. ठीक है? Okay, just this one more thing, two more images that I want to show you for the day today. Look at this. You could be asked to label these parts, okay? Now, suppose I have a cutoff over here, guys. Just pay attention to this. मान लो cutoff यहाँ है, okay? So, whatever, when you have an area more than cutoff, ठीक है? More than cutoffs. तो ये क्या होता है? True positives. Yes? If this is true positives, above cutoff से ऊपर. So this is true positives. Then what is this going to become? False negative. Yes. And if you have an area below cutoff, अगर below cutoff हो गए आप cutoff से नीचे, so that means this is okay. If you score less than the cutoff, true negatives hai, and this one over here will become false positive. We all know sensitivity क्या होती है? Sensitivity is true positives plus false negative. Okay, and specificity guys is remember true negative plus false positives. Technically देखें तो अगर मैं अपने कट ऑफ को B पे कर देती हूँ, when I increase cutoff to B guys, what is going to happen? When the cutoff increases to B, the cutoff is here. So which portion is increasing? This entire portion is going to increase. When you increase your cutoff guys, जब आप cutoff increase करोगे, the area to the left of the cutoff increases. So true negative increases and false positive decrease. That means specificity increases when I increase my cutoff. But when I decrease the cutoff guys, जब मैं cutoff को decrease कर देती हूँ to A, so I have decreased the cutoff to A. So which portion is increasing everybody? ये वाला portion बढ़ रहा है, ठीक है? That means true positives increases when you decrease the cutoff, true positives increase and false negative decrease. That means what increases everybody? Sensitivity increases. Clear? So you could be asked what happens when you increase the cutoff. Just imagine cutoff यहाँ पे है, ठीक है? This is my cutoff. Now I have increased the cutoff to here. So this entire portion is negative, true, negative. So true, but we will have some false positive also, but ideally true, negative or specificity increases on increasing the cutoff. But now from here I bring the cutoff to here. जैसे ये है cutoff, मैं यहाँ ले आती हूँ. I lower the cutoff. So this portion increases towards the right hand side. So true positives increases everybody. All right, and false negative decrease. So sensitivity increases. Best to decide the cutoff. Okay, which is the diagram which is best to decide cutoff, guys? What is the diagram that you draw which is best to decide cutoff? Is ROC curve. All right, at least know the name. Is receiver operating curve. We just can't keep any cutoff. We need to keep a cutoff which has good sensitivity and fair specificity. So which is that diagram? Receiver operating curve. Okay? Okay. Now, last one more MCQ. Let's do it for today. And then we're going to continue it again from tomorrow, guys. From tomorrow, okay, we'll be looking at the MCQs from the back chapters. Okay. Now, today we have done MCQs from the front wale chapters. Okay. Tomorrow, at the same time, we'll be looking at MCQs from the back chapters. So can you tell me what is this, everybody? Ye kya hai? What is this? So here you could be asked, what is it that you desire for a screening test? Do you desire it to be accurate and precise, not accurate and precise? What? So please remember, because screening is a favorite chapter, accuracy slash validity. What is accuracy slash validity? It is ability of a screening test to differentiate diseased from non-diseased, guys. ठीक है, diseased को non-diseased मतलब how close a screening test comes to the gold standard value. How close a screening test comes to the gold standard value. Gold standard value है ये, the value which the diagnostic test gives me. And where does my, or how close the screening test comes to the gold standard value or the central value. Okay, now a screening test should also tell me what a diagnostic test tells. Near to the true value. It should be, a screening test should be closer to true value. Okay, should be closer to true value. Or you could also say it has to be nearer to the true value. या तो वो closer होगी true value से या वो nearer होगा true value से. Now look at this image. ठीक है? Can you look at this image? Every time when I am hitting my dart, guys. Okay. Okay. Before that, what is precision? Precision means repeatability. Okay, repeatability. Repeatability means findings are replicable or reliability. ठीक है? Repeatability, replicability, reliability, consistency. That means I'm going to get the same findings. Okay, what are the findings? The findings are replicable in different settings. ठीक है? मुझे same findings मिलेगी as the number of times I repeat the test. I'll be getting the same findings. Okay, so look at the first diagram. 4 times I've hit the dart, central point पे hit हुआ है. So this test is accurate. It is close. It is hitting at the central point. Precise every time it's hitting at the same point. Okay. Look at this one. Not accurate but precise. Why is it precise, guys? Because every time it's hitting at the same point, but it is far away from the true value. Right? So it is not closer to the true value. Not accurate मतलब होता है not closer to the true value. It's not closer to the true value. But every time it's giving me the same value. ठीक है? So, and this is what accurate. Why is it accurate? Closer to true value, but it is not precise. Why is it not precise? क्योंकि सारे times ये अलग-अलग point में hit कर रहा है. And what about this? Not accurate and not precise, guys. Every time it's hitting at different points and it's also far away from the true value. So your question will come, which property of a screening test do you desire? Okay, which property? और स्क्रीनिंग टेस्ट के लिए बेस्ट क्या है? Which property of a screening test is desired? So it should be both accurate as well as precise. Is it clear, everyone? Did you understand this diagram? They can give you this image and they can ask you what is the property that you desire of a screening test. Okay, like suppose we have a senior resident who has been trained to examine the conjunctiva to look for anemia. So is this like, what is her method lacking? Validity, reliability, kya lack karta hai? So she has to examine. So you have a senior resident, guys. She has been trained, okay, trained to examine conjunctiva. Now, as many times she examines the conjunctiva, she is going to get the same finding. Yes, so it is reliable. It is reliable. Think again, everybody. Anuradha, एक बार फिर से सोचो. She has been trained to examine the conjunctiva and report anemia. So the findings are going to be what? The findings are going to be what? The findings are going to be reliable, everybody. But is it the best way to examine, find out about anemia? Is it the best way? Is it the best way to diagnose anemia? No. The best way is to do what? The best way is to do what? How do you diagnose anemia, guys? The best way, everybody, anemia diagnose करने के लिए क्या है? Look at the hemoglobin status. All right, everybody, ठीक है? Did you understand this, guys? Did you all understand? Okay. So I think these are enough for today. Okay, we've done the first part. Tomorrow we'll be starting from biostats, same time, guys, 2:15 to 4:15, and we will be giving a thorough look to PSM again. We are done with the first part. Tomorrow again we are going to have a look at the second part, guys. Okay, so we'll be starting at 4 2:15 again, next I mean tomorrow. I hope this session has been useful to all of you guys. You've understood, we've revised the first portion, looked at some of the important points, guys. Also just wanted to tell you that if you want to take an Unacademy subscription right now, guys, you're getting the plus subscription at only rupees 299. Okay, just 299. Use the code PSM10, or you can use the code PSM live, or you can use the code Dr. Neha 10. Okay, and you can take this amazing 1 month offer. ठीक है, प्लस सब्सक्रिप्शन का 1 महीने का सब्सक्रिप्शन मिल रहा है, गाइज. उसको ले लो and get the best out of this few days that are left for your exams to learn from your wonderful educators on the platform. You'll get access to all the questions, everything that's there on the platform. You can just subscribe now. Also, just download the app, use PSM10 PSM live. Only for 299 you're getting a plus subscription. Okay, thank you so much, everybody. I'll see you again tomorrow at the same time, 2:15 p.m. everyone. We'll look at all the back wale chapters and complete PSM. Thank you so much. Keep studying, keep revising. All right, don't give up. You still have time, so give your best. You've already traveled so much of a journey, so thoda sa bacha hai, usko please don't give up during this time. Okay, all right. Best wishes, everybody.